we want to talk about mental health because I'm
Yeah.
thrilled. You were
Yeah.
nominated as the Mental Health Leader of the Year for Utah HIMSS. And that's a partnership with my nonprofit that is dedicated to improving physician and clinician mental health, Sharp Index. So, and I haven't met you before. So
Nice
I
to meet
wanted to
you.
hear about your work. Like you're getting so many votes and so many people have reached out to us to tell us you're cool. So no pressure. No pressure.
I had to message Cade when I got that email. I was like, is this a joke? It was so unexpected, and I'm really honored and humbled to have this conversation. So thank you.
Thank
That
you.
it means a lot to me in my work life, in my clinical life, my professional life. So I am just thrilled to be here. Thank you.
I'm glad you're here. I think sometimes this happens in mental health and with our awards. It's happened before. Like I met Carol Bernstein, who's like, she used to be the president of the American Psychiatric Association. She's just like, really? Like people, and this is part of why we started recognizing leaders in mental health. People who are involved in mental health aren't always as used to being recognized.
Yeah.
There's a lot of hard work and there isn't a lot of recognition for it. So I wanted to hear about your journey. Like, how did you end up doing what you do? Let's start there, and then I'll ask you more.
Okay. Well, so I am a physician and I work in emergency medicine. So I think clinically, what sets emergency medicine apart is it's so real. It's this moment of truth between a patient and their clinical team, and you understand. It doesn't matter what you come into the ER with, your socioeconomic status. You're hearing these real stories and these true, and so that's just a privilege to share that with a patient. It also means that that relationship is so important. And when I got into residency, I started to realize there's all these barriers to how we connect with each other. And one of them that I tended to really resonate with was our technology barriers. And so even in residency, I was redesigning how we distribute information to the clinicians, how we distribute it to the patients. My program director was so supportive. And so I redesigned how we did conference so that you could have references with one click for any clinical algorithm, because the pressure of wanting to do the right thing and the abundance of information and the noise that surrounds you is real, and it's a real impact. So I started doing that, and then one of my program directors said, Tam, you're doing informatics. And I said, what's that? And but there was all these moments, a moment where a patient that was coding, we were able to give him TPA within 2 minutes because I had the appropriate protocol on my device, and no one could find it in the rest of the university system for like 6 hours because they hadn't designed a system to do it. But I had designed the system that the 30 residents all had access to it. So all these moments in residency that really reinforced what it meant to create systems for success, so that you, as a person, as a caregiver, can connect with your patient. Because ultimately, my guiding force has been, I will create systems to support that patient and that caregiver and their relationship. That's my measure of success in whatever I do. So I did so I did an informatics fellowship, and that was amazing. And then went over to Intermountain and started working clinically. They were in the midst of their transition to Cerner, so I got tapped to assist with that and became a medical director over emergency medicine and acute care for the informatics digital technology services, and supervised that workflow for a long time. And then when COVID hit, I was designated as the Intermountain physician informaticist lead for all the COVID workflows.
Oh, wow.
So this became a lot more patient facing as we decided how to facilitate COVID risk stratification for patients, how to facilitate testing, how to make that information clear to the caregivers. In the midst of it, I'm feeling such duty to support my friends and caregivers who are putting their lives on the line. That's how it felt. And then our patients who need the information, need those resources. And so I had this beautiful opportunity to pull together a team of very talented individuals, and we designed things that had never been done before for patient access to COVID testing, for provider workflows, clinical workflows, isolation, nursing, all that. And gosh, that was, I don't know that you could ever learn that in the classroom. It was very humbling. Um, and one of the measures of success that I have as a leader is when I leave a project, is if a team continues to have that forward momentum, psychological safety. And I had a baby like a year and a half into COVID, my second child, and I left and I came back and the team was doing even better. It was just so gratifying to create and multiply people rather than diminish and saying I'm the expert in everything, because I'm certainly not.
I like that.
And
Being able to build a good teams matters. Yeah.
yeah, and to make yourself eventually not a requirement. So, um, my teams are happy, and I've made incredible close relationships and friends throughout this time, and that's really meaningful to me as we impact that human experience of healthcare.
Yeah.
And so now I am, I got another position elevation. So I'm Associate Vice President and Associate Chief Health Information Officer for Intermountain, and I'm currently over our 2/3 of our market for provider and experience for Utah and Idaho. And I also am focusing in digital therapeutics with a focus in behavioral health, as well as the peripartum experience, where we're creating automated solutions for patients to guide them through different steps of their care without necessarily having to tap clinical caregivers at each step. Um, so that's where I am.
That's
And
nice.
yeah,
I might have some questions. I want to go back to some of what you talked about at the beginning and talk a little bit more in detail about the signal to noise you're talking about, building
yeah,
solutions for getting people the data that they need. A lot of physicians identify electronic health records and as a source of grief
absolutely.
for care. And I don't know if everybody watching this will kind of understand what does that actually look like? Like when we're talking about they have all sorts of data, but they can't find the right thing. Why is that? And what does that mean?
Well, there's many different folks' perspectives on it. This is just mine. But the electronic health record was built initially to facilitate billing and coding and record documentation. It was not built to facilitate clinical care. They're two different, very different things. And our first wave of electronic health records were often built as a copy of paper forms rather than asking how can we truly automate likelihood of disease for a patient. So if you take sepsis, for example, sepsis is a spectrum of disease as you go through and develop it within your body, and your body creates an inflammatory response. The way we define sepsis comes from 8 to 10 different disparate data points. And we have a likelihood stratification with calculations if you meet criteria for a certain category of inflammatory response versus severe sepsis versus septic shock. When that comes down to, I'm a physician, I'm trying to decide if you have sepsis. If the computer screen puts my data points for sepsis, for heart rate, white blood cell count, lactate on 5 different screens, it's really hard for me to figure out. I have to click 5 times to get all that data together. If my EMR presented all of them on one screen, or even better, if it ran an algorithm to tell me the likelihood of sepsis on your own from a 10% to a 90% likelihood based on intrinsic artificial intelligence, that's an EMR that's designed to help me rather than an EMR that says, go to these 5 different drawers. It's kind of like if we said we expect everyone in the hospital to wash their hands, but we only have one sink. How are you going to expect everyone in the hospital to wash their hands? So it's designing an environment to create success for the patient and the caregiver team.
That's awesome. No, I think that does make sense. Like people have to go get data out of all sorts of different places. Um, so tell me more about the work that you're doing in mental health, because you said like
Mhm.
4 different projects, right? Or yeah.
Yeah, so for mental health, I guess I would classify all the work that my teams do to improve workflow for clinicians and patients is a form of mental health. If I can improve the efficiency with which you go through your workday, you're doing your tasks, if I can take away from the time in front of a screen, you'll have more time with the patient, which creates better outcomes for the patient and the caregiver. So that's the basic metric for all of my projects. In addition, when you think about specifically building in mental health screening for patients and support systems, we create several different workflows for suicide likelihood within acute care, for resources to get to a patient, how that is accessed through a patient portal so that I can access counseling resources on my own. So we have several programs that we've launched that patients can access through our patient portal, or they might go through a cognitive behavioral therapy session on their own without having to make an appointment. And it guides them through checking how their depression scores are initially, recommends sessions for them, and then reassesses. Those are vendors that we engage with. And a part of my team's largest job is to ensure that those programs are working, make sure that they're providing the value to the patients, make sure that we aren't just having something that no one engages with and holding it to a standard that's actually improving the patient's experience of what it feels like to be a human in their own body. So
Right.
those are part of the digital therapeutics that we're creating for an enterprise vision for our healthcare organization.
It has to be something people want and people use, and that actually helps them.
Yeah, it's kind of
Which
easy to.
sounds simple, but it's not.
Yeah, and we're kind of in this world of a digital explosion, similar to the tech boom or the dot-com boom of the 2000s, and everyone has a design solution, which is great. But we have, as a healthcare organization, a responsibility to hold ourselves to standards that work rather than buying something shiny, making sure that it's creating the outcome that's meaningful to our patients and our caregivers, because we're creating these projects for both, is a duty.
Yeah. When you say making sure it's meeting the needs of like caregivers and patients, how do you measure that? Like, how do
Great
you
question.
decide?
So some parts of these we're still figuring out, to be honest, because when you look at national metrics for impact, there's often you see, well, are they logging into the thing? So, similar to vision and attention, Facebook, Instagram, is the goal to have a patient scrolling and looking at my thing that I wrote that I think is so great? Or is the goal for the patient to say, I feel better in my life, I feel balanced in my life? Um, so some of these mental health tools that we've released to both patients and our caregivers are performing the same function. And so we look at their scoring for their self surveys before and after rather than how much screen time they're having in the specific interaction.
Yeah, that's like you learn that too when you're playing video games. Like they're
Yeah.
trying to keep you there, keep you engaged.
Especially if you think about the adolescent population, the goal actually should not be having them on their phone, like maybe 5 minutes a day to interact with the solution and then move on with their day.
Right. I would love to hear what your personal wish is for healthcare and mental health. It's a little bit of a switch.
I like that.
Bruh.
I My wish is for us as a society to fully acknowledge the true impact a person's psychological and emotional state has on their entire health and well-being. Every day I do shifts in the emergency department, I see patients come in, they have symptoms. We don't find it's a heart attack. And often the phrasing they come at me with is, well, it's just anxiety. It's just in my head. It's actually not true. Like, just anxiety is a huge deal. We have evidence to show that the likelihood of anxiety and poor stress management directly increases your likelihood for cardiovascular disease, your likelihood for early dementia, your likelihood for poor overall control and well-being. And people minimize that experience. We distract ourselves. I see the repercussions of that years later in the emergency department. I often see it earlier too, but I gave a lecture to my patient yesterday. Um, Called it a TED Talk, but it was a lecture.
Yeah.
And, and he was young, and I said, "This is really important." And we got him in to start with therapy. We got him in to start with one of these apps that I was talking about, um, and talk to his family about what it means to have a life that feels good when you wake up. Um, so that's my biggest wish, is that we acknowledge the power of mental health, and that it's just in my head.
Right. I think that that's powerful too, what you said, where like, what does it mean to have a life that feels good? Like
Yeah.
that, the life you would want to live. I think about it too sometimes when I'm like, what would ideal me do? Like
Mm, yeah.
whenever I'm in crisis, I'm like, I'm gonna just pretend because I can postulate what ideal me would do. Um, what's next?
Sorry, you cut out for a second.
Oh, I said, what's next for you in terms of mental health improvement? And
For my job?
oh, that was an open-ended question on purpose.
um, I think there's big things and small things. So, for work is, we're holding ourselves to an initiative to create impactful digital therapeutics for mental health for this upcoming year, actually. So, creating that strategy by the end of this year and implementing it, and holding that to specific outcomes. In my personal life, I think I'm a parent to two young toddlers, and um, understanding how they experience their mental well-being is teaching me every day, and really humbling, um, for what it means that it's good to be angry, to know that you're angry, and to talk about it. And so I'm staying really humble and curious as I guide and learn from two very young individuals, that are my children.
Very honest, yes. Toddlers, they'll teach you about immediacy, right?
Yeah. But continuing the dialogue wherever possible, and supporting our leaders that are in mental health, through my teams, through the power of technology, I think will be one of our legacies moving forward.
I love that. Supporting teams through technology. Okay, my last question is, um, what would you tell people who want to get involved or who are like in need right now? Both clinicians and patients in the area.
I would say trust your voice and find your path. There are a myriad of opportunities. One part of it matters is that you get some positive feedback. So find a place where you see a gap, even if they aren't asking for help, show up to the table, give your voice, share your experience. Um, People respond to truth and honesty, and we have a huge, huge need right now as a society. Any voice that speaks with truth is going to be incredibly powerful.
Oh, I love that. I want to thank you for sharing your story with me
Thank you.
and for encouraging people to share and set up systems that help with that. Like it's really important to have things easy as we all need each other.